Hey, Dr. Tyler Williams at Better Sleep SLC. Thanks for joining us for the video today. You're here because you have some questions about a mouth guard and different kinds of mouth guards, and maybe you're currently wearing one, or maybe you've been told you need a mouth guard and you're trying to figure out what would work best because there are over-the-counter options, there are cheap options that a dentist can make, and then there are higher-end custom options that a dentist can make. So what we'll run through is 4 types of mouth guards. Okay, the first one are your over-the-counter mouth guards. These ones can be boil and bite or just pre-made mouth guards, and these can be used to treat anything from teeth clenching to snoring. Now, these can be good for temporary measures, but there are some problems with them. One, it can cause your teeth to shift, or it can cause your bite to change, and that can be a big issue. The other one is that if you have something like snoring, they're not FDA approved to treat sleep disorders like sleep apnea. They're just strictly for snoring, and so it's more of a cosmetic fix. Your second type of guard is going to be a grinding guard that is custom made by a dentist, and there's a whole bunch of shapes and sizes on these. Really, you want to work with a dental team that understands the root cause of the issue, not the symptom. So what I mean is, if you have teeth that are chipped or cracking, you need to ask your dentist what type of bite you have and what type of guard they're going to recommend for that type of bite, because no two are alike. And even if your spouse or your friend has a teeth grinding guard, you probably don't want the exact same one as them. We're not built exactly the same because you have different bite and different issues. But these are custom fitted and they stay in your mouth well. They are usually pretty durable, especially if you get something on the medium to high end. They can last many years to come. Your third type is going to be your TMJ appliance. Okay, now these can be for grinding or clenching your teeth as well, but they're also designed to help your joints. So if you have clicking, popping, morning headaches, swollen jaws, or enlarged muscles, or sometimes people will get more of a squared off chin because those muscles get so big, that's going to be a TMJ appliance. And these get even more custom and even more specific. So you don't want to have just anyone make one of these for you because TMJ is a medical condition and you want to make sure that's addressed. So TMJ is a little bit of a misnomer. TMJ actually means temporomandibular joint. All of us have a TMJ. So it's kind of like saying I have a knee joint, right? We all have those. So sometimes TMJ is referred to TMD, but that type of appliance can treat grinding as well. So you can kind of get a 2-in-1 where you're treating clenching and grinding, but you're also treating your joint or your temporomandibular joint disorder or disease to help that feel better. Now, your fourth kind of appliance that qualified dental professional team can make you is for sleep apnea. This is for obstructive sleep apnea or for snoring. These are for people who are not getting enough oxygen during their sleep, or their partner's kicking them out and making them sleep on the couch or another room, or you're waking up with being tired, morning headaches, gasping, or you just feel like you can't get moving, and then in the afternoon you just want to crash and fall asleep. So this is kind of our niche at Better Sleep, is we help people with these type of devices. These are approved by medical insurance and Medicare. They are not dental devices. They are actually medical devices. They go in your mouth, but they're to treat a medical condition similar to TMJ. So if you have problems with CPAP, or you don't want to wear a CPAP, or you want to avoid surgery, these are often your best option. So make sure you meet with a qualified team to get that addressed. Now, if you have some questions on these, how they work, any of these 4 appliances, you can call us or text us. You can even text us a picture of your mouth or your teeth or your device, and we can give you some feedback that way and see how we can help. So thanks for checking out today's video. We look forward to seeing you on the next one, and have a wonderful day.